Hi, I'm Amy from Occupational Therapy, and I'd like to talk to you today about this abductor sling. The purpose today is to educate our nursing staff a little bit more on how to properly position our total shoulder patients here at Milford campus. It is a challenge, I understand. Post-operatively, it's very difficult to get this sling in place, as well as once they come up to the unit, our patients are still in the beds. So it is difficult to get the sling into the proper position. But I'd like to just educate you first just to recognize when the sling may be ill-positioned and how to best reposition them as you are able. So I'm going to start first with the finished position so that you see what it is supposed to look like on our patients. And then I'm going to break down the sling components and talk about them a little bit more. Okay, so sling. Arm is positioned into our abductor sling. The arm is at a 90-degree angle at the elbow here. Okay, you don't want the shoulder dipping downward. You want that arm to be nicely supported. You don't want it draping behind our patients in the bed. If it's falling backwards, that puts a lot of pressure onto the patient's shoulder, potentially. I mean, they may be numb, obviously, to begin with, but we want to protect the integrity of that shoulder. So a little bit in front is good. The arm positioned in the sling itself with the elbow all the way back, as far back into that cup as you can. There is a strap in place on the sling itself to help you maintain that position. So once you've got the elbow back in that sling, this strap here will help hold that elbow back into place. The hand and wrist should be supported. You don't want that hand draping outside of that sling. Make sure that that arm is back again as far as you can. There is another little strap here on the front of the sling that can be positioned between the thumb, the index finger, to help prevent that hand from sliding forward. Be mindful of the skin integrity on that web space. If it gets red, it can be loosened, of course, but if the arm is positioned all the way back, that's our goal. There is another strap on the front part of this sling, which attaches, of course, to the neck strap. The neck strap should be placed behind the shoulder blade and draped up and over the neck, and that's where it's going to clamp into place. The strap itself should be snug. If it's too loose, you'll find that the hand is going to dip downward. Again, we want to support that arm as best we can. So that strap should be up